Hi, my name is Nicole Allen. I will be your nurse practitioner today. I'm going to do a head-to-toe assessment on you. Can you tell me your name and date of birth, please?
Melissa Alford, 11/18/80,
Great. And what year is it?
2015,
And where are you?
Long Island University.
Okay, I'm going to give you 3 words. I want you to repeat them back to me, and I'm going to ask you them again later. Ball, dog, and car.
Ball, dog, car.
Great. Can you count backwards by 7 from 100?
Yeah. 93, 86, and 79.
Great. Can you recall those 3 words I told you again?
Ball, cat,
Car.
car.
Right.
Ball.
The patient is alert and oriented ×3. Her speech is coherent, and recent and remote memory is good. So now I am going to take your vital signs.
Continuing on with your eye exam, I'm going to take a look inside of your eye to note the retinal artery vein opposite your okay, breathe in the right hand and look behind. Okay, so I see your macula, optic disc, retinal artery and vein.
106/58 on the right arm.
Continuing on with your head exam, we're going to go to your ears. So I'm looking at your ears symmetrical as your eyes are symmetrical. But before we move on, I'm going to test your lacrimal sac. So I'm just going to slightly touch here. And please can you pull down on your lower lid so I can see your macula, which is nice and clean. Nice and white. Eyebrows have good hair distribution, and so do your eyelids. There's no swelling or bags. Okay, continuing on to your ears. I'm going to feel your
And 1/8, 108/60 on the left. Now I'm going to check your pulse for 15 seconds.
No nose, no nodules, no X-ray. We're going to continue with an inner ear exam.
It's about 65. Rate is regular, and I'm going to check her respiration now. Just breathe normally, okay? For 15 seconds.
Panic membrane, see the color of it, and if there's any perforation or anything. So it's like up and back, it feels like moving your ear.
It's about 15, even unlabored.
See the on the right, back,
Okay, now I'm going to go to Melissa's head. I'm going to inspect it. It appears to be no masses, no lesions, normal cephalic. And size is symmetric to body. I'm going to palpate. Any tenderness?
No.
Very good. So your acoustic nerve is in the back. Continuing on.
And check between the hair creases for any lesions or scales. No lesions or scales, no tenderness.
Your nose is in
The hair texture is fine and smooth, and the distribution is even throughout the head, no alopecia. I'm going to go down to the face. The face is symmetric. Eyes are symmetric bilaterally. Lips are symmetric. Nose is midline and symmetric. Any tenderness?
No.
No tenderness to the face. I'm going to palpate the temporal artery. and the TMJ. Can you open and close? And move it side to side. Great. No clicking or cracking noted. I'm gonna go to her eyes now. Eyebrows have even hair distribution, symmetric bilaterally. Eyelids are symmetric bilaterally as well, with eyelashes facing outward. The pupils are round and equal symmetrically. Iris is brown. Cornea is clear. Sclera is white. No redness or lesions. Lateral and medial canthus is equal bilaterally and symmetrical. Any tenderness? No. No swelling to the lacrimal gland, and no discharge. To the puncta. And can you pull your eye and look up? Great. And pull up and look down. Sclera is white. Conjunctiva is red or pink, moist. No lesions, no redness, no scarring. So I'm now going to check for direct and consensual pupillary reaction. Okay. Great. Great. And then the left eye. Direct and consensual pupillary reaction, symmetric and bilateral. And then I am going to check for a confrontation, okay? So cover this one. Tell me when you see my finger.
Down. 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 Down.
And then cover the other eye.
Down. 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 Down.
Great. And check for convergence, accommodation, equal bilaterally. I'm going to test your extraocular movement, so follow this pen light.
And I'm going to start by first assessing the spine. And you tell me.
Great. Now I'm going to test optic, the cranial nerve 2 for acuity, acuity with the Snellen chart. This is the Snellen chart. From 20 feet back. Cover one of your eyes and tell me the lowest line.
D-E-F-P-O-T-E-C.
Great. And try the other line.
D-E-F-P-O-T-E-C.
Great.
I'm
D-E-F-P-O-T-E-C. 20/20 vision. Great. And now I want to check the inner eye.
Oh, that's a new one. I just put on there.
Oh, there's one on? Great. Oh, that's not it anyway. So I'm going to look into her inner eye now. Okay. I'm going to put my hand on your head. Red reflex present. Optic disc visualized. Macula present. Retinal vessels present. No nickeling. And clear disc margins. No opacities. And this side too. Red reflex present. Optic disc visualized. Disc to cup ratio 1:2. Retinal vessels visualized. No nickeling. No opacities, and macula was visualized. Great. Now we're going to go to your ears. I'm gonna first check your hearing, okay? I'm gonna stand behind you, cover your right ear, and I'm gonna whisper something and repeat it back to me.
Book.
Great. I'm gonna stand 2 feet behind on the other side.
Car.
Yes. Great. Now I'm gonna check the Rhine test. Tell me if when you hear it and when it stops.
Yes. Stop. You hear it? Okay, stop.
Air conduction is greater than bone conduction.
You hear it? And stop.
Very good. While I'm here, I'm
And
going
stop.
to test for your
Right. And now I'm gonna test the Weber test. Tell me which ear you hear it in.
Both ears.
Great. Next, I'm gonna check the ears are symmetric, even with the lateral canthus of both eyes. No lesions present. No masses. Any tenderness here?
No.
Here.
No.
No tenderness to the tragus or mastoid process. Any tenderness?
No.
No tenderness or masses on palpation. I am now gonna check the inner ear. Pull up and back. Insert downward and forward. Cone of light present. Anteriorly and inferiorly. Malleus in center. And pars flaccida present. Tympanic membrane pink or pearly white. No perforation. No scarring. No redness or inflammation. Pull up and back, down and forward. Tympanic membrane, pearly white. No scarring, no redness, no inflammation or perforation. Cone of light present. Malleus center. No wax, and pars flaccida present as well. Do you have any tenderness?
No.
No tenderness on the face. How about here?
No.
Or here?
No.
No tenderness to the frontal or maxillary sinuses or to the face. Next, we're going to inspect your nose. Any tenderness?
No.
No tenderness present, no masses, no redness visualized. Can you close one nostril? Breathe in and out. Great. And the other? Great. I'm going to check cranial nerve 1. Can you block one now? You smell this?
Yes.
Great. And the other one?
Yes.
Great. Now I want to look in your nose again. Okay. I'm gonna look inside the nose now. Mucosa. Mucosa light pink. No discharge, no swelling, no perforation to the tympanic membrane. To the nasal septum. No perforation or deviation to the septum. Mucosa pale pink. No discharge, no swelling, no polyps. Nasal septum pink. Moist. No deviation or perforation of the septum. Okay, and now we'll go to your mouth. Lips are pink, moist, no lesions, no masses. Can you open your mouth? Tongue is pink. Mucosa is even, no fissures. Can you lift up your tongue? No lesions or masses on your tongue. Tongue is moist. Mucosa is pink. Stick out your tongue. Say
Ah.
Soft palate and uvula elevate upon the cranial nerve 9 and 10, no deviation, and no exudate on the tonsils, and tonsils were not visualized, or no exudate on the pharynx. And then teeth and gums are intact. Can you stick out your tongue? Move side to side. Cranial nerve 12 intact as well. I'm going to check cranial nerve 5 now. Can you bite down? Master muscles intact. Close your eyes. I'm going to try to open. Resist. Great. And for sensory, tell me when you feel.
Yes. Yes. Yes.
Great. And for 7, cranial nerve 7, I'm going to have you open your eyes wide, clench your teeth, smile, and puff out. Great. And I'll do cranial nerve 11 now too. I'm going to have you shrug up against me and turn your head against me and turn your head against me. Great. Now I'm going to move on to the neck. The neck is symmetrical, no masses, no pulsations. Trachea is midline with no deviation. I'm going to now inspect the lymph nodes. Preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical chain, deep cervical chain, posterior cervical chain, and supraclavicular. Now I am going to palpate the thyroid gland at this time. Can you swallow? Is there any tenderness?
No.
No tenderness. Thyroid moves symmetrically, no nodules, no lesions, anything like that. I'm going to palpate your spine. Any pain?
No.
Great. Now I am going to move to the respiratory system, if you don't mind taking off your shirt. Get all my stuff ready. Great. Okay. Respirations are even, no retractions, no bulging, no labored breathing. There is the AP, the lateral diameter is 1 to 2. And I'm going to inspect the posterior aspect of her back first. Upon inspection, there's no lesions, there's no masses. Skin color is even throughout. Any pain or tenderness?
No.
No pain, no tenderness noted on palpation. Can you say 99?
99. 99. 99. 99. 99.
Tactile fremitus good. Now I'm going to percuss bilaterally.
So as I'm going down the skin and your integument system, you have good hair distribution, there isn't any spots with hair loss.
Great. Now I'm going to percuss for diaphragmatic excursion. So take a deep breath in and hold it.
Posterior tibial.
Great. And exhale and breathe normally. Now take a deep breath in and out, and when you exhale, hold it.
Here as well. Have good skin color, your teeth, the capillary detail, no edema.
Measure.
Like, say it's damages to anyone.
Diaphragmatic excursion is 3 centimeters. Let me measure. Great.
So continuing is, I'm going to have you
Please don't tell me
flex
anything.
your
Just tell me
clothes
move, but
down.
Now we're gonna move on to auscultation. I'm gonna auscultate bilaterally.
just see that.
We're gonna go ahead
You
and
didn't do
continue.
the
Take a
skin.
deep breath in and out through your mouth.
I did. Okay, I need to do skin, but skin is only 1%.
So please relax.
Right, it's 20%. I can feel it. Right.
Carry water back up, so
Sides.
that's
Now
And I
I
lost my
don't-
phone.
now I don't have charger. Now I have battery.
Okay, and now I'm gonna auscultate, and when I touch your back with the stethoscope, I just want you to say E, E,
Please shut up.
E, E,
You
E,
do
E,
like that against me.
E,
No, it's not against you, it's just.
E,
Just
and I want you to whisper 99 again.
And Achilles.
E was heard with egophony, and nothing was heard with whispered soliloquy. Breath sounds are equal and symmetric bilaterally. Now we're gonna move to the anterior chest.
Check where whatever you feel
Take a deep breath in and out.
Close your eyes and turn
Chest expansion was symmetric posteriorly. Any pain or tenderness?
No.
Great. Tenderness?
No.
Okay. Take a deep breath in. Out. No tenderness, and chest expansion equal and symmetric. Say 99.
99, 99, 99, 99.
Tactile firmness. Now I'm going to percuss the front.
Now, I'm going to put something on you, you're gonna tell me exactly what it is. Okay, so close your eyes.
Great. And now we're going to auscultate.
Good.
Take a deep breath in.
I'm gonna do this bilaterally. Okay, so now we're gonna continue with the exam and I'm going to check your balance. So, stand for me.
And I'm going to say E again for me.
E,
From
E,
here
E,
to
E,
this way, normal in a straight line.
E, 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 E.
And whisper 99.
Yes, so.
Sorry.
On your way back, that's where you're going.
Anterior and lateral fields were clear bilaterally and symmetric. And
And on your way back, I
egophony was E. E was heard, and nothing was heard on whispered soliloquy. Now we're going to move on to cardiac.
to your shin.
So the 4 areas that we're going to auscultate and palpate today are the aortic at the right sternal border, second intercostal space, pulmonic at the left sternal border, second and third intercostal space. The tricuspid is at the 4th and 5th intercostal space on the left sternal border, and the mitral valve is on the left 5th intercostal midclavicular line.
At the wall.
So we're going to listen with the diaphragm and bell in each of these areas.
Open your eyes, please. Now, move your hands out and with your eyes open. Now with your eyes closed. Very good. Now if you have a seat for me again, please. I'm going to just check your resistance.
And with the bell.
So, have your arms up. Push against me. Pull forward. Push against me. Pull forward. Okay. Pull up. Down. Okay. Pull back. Back.
Now I'm going to put the head of the bed to 30 to 45 degrees.
Forward.
So now I'm going to palpate those areas for any heaves or thrills, and then we're going to auscultate with the diaphragm and bell in the 4 areas for the head of bed at 30 degrees.
And inwards like you're touching the bra. Alright. Now turn it out and tone it up.
Harmonic,
Loosen it
bicuspid,
and flex
and mitral.
forward.
You're gonna feel for the PMI.
Close in. Very good.
PMI is brisk and tapping.
Finish our exam. Thank you so much for being my patient today. Thank you very much for being here.
The diaphragm.
I don't know if you want to, you can move. The thing, the finger, you didn't do the flexion. You didn't.
Now I'm going to listen to the carotid pulses and also palpate them.
You said
Yeah,
yeah.
thanks.
Yeah, fix it, but still, you don't want to fix it. One. Okay, can I practice? I know, when you sit down, you remember everything, but when you're doing it yourself, you're so nervous that you.
And I'm going to have her turn her head to the left and assess for the carotid pulsations. Carotid pulsations are present, no venous jugular, JV, jugular venous dissension.
No, I was like, I don't think it's whatever.
Okay. Now I'm going to assess her peripheral pulses as well. So we're going to check her radial pulse, the brachial,
I just couldn't remember, so I
Auscultation
just
also,
read it.
you don't have to do it from front.
radial and brachial, +2, bilaterally symmetrical.
No, inspect.
Femoral +2, symmetrical.
It's not, it doesn't say that you have to do it from the back, I mean from the front. It's anterior chest.
Popliteal pulses, present equal bilaterally, +2.
This one you don't
Posterior
need to-
tibial pulses. And dorsal pubis.
That's why it was let, like video, what do you think?
Now I'm going to have, there is no cyanosis or clubbing. Capillary refill less than 3. Skin is equal bilaterally. No peripheral edema present. Checking for 3 seconds and these 3 Great.
You didn't do the,
I'm gonna have you sit up for a second and do your mitral. So I'm gonna have her lean forward and auscultate the mitral area with the forward bend with the mitral, with the bell and the diaphragm. Good. No extra sounds. Pulse is good, or heart sounds are good. S1 and S2 clearly heard. Now I'm going to have her supine. for the abdominal exam. Great. First we're gonna inspect the abdomen. Abdomen is flat, symmetric bilaterally, no pulsations, no scars. And we're gonna auscultate first for bowel sounds in all 4 quadrants. Okay, bowel sounds present. Now I'm going to percuss the abdomen in all 4 areas, assessing for any tenderness.
That's cranial, well, spinal accessory.
Any tenderness?
No.
I'm gonna now percuss the liver span.
And then I'm a nurse.
Liver span is about 6 centimeters. And now I'm going to percuss the spleen. Okay, and now I will lightly palpate the abdomen and the 4 quadrants. Any tenderness?
No.
No deep palpation? Any tenderness?
No.
No tenderness. Now we're gonna palpate the liver edge. So take a deep breath in and out. Liver edge was felt, and now we're gonna palpate the spleen. Take a deep breath
My
in
name is Bianca Mo. I'm gonna be your student
and out.
practitioner today. How are you?
Spleen not felt, no spleen enlargement or splenomegaly. And you can see, actually, I'm gonna palpate the inguinal nodes. Sorry,
No, it's good.
no nodes present, okay? And when she's sitting up, I'm gonna see if there's any tenderness.
No.
No tenderness at the CV costovertebral angle. Now we're gonna go on to musculoskeletal. Okay. First, I'm gonna check your spine or your neck. So we're gonna have you lean to your chest, look up at the sky, turn towards the curtain, turn towards the computer, and put ear to shoulder, ear to shoulder. No pain or tightness there? No. Good. So now we're gonna go to the hands. We're gonna inspect the hands and all the joints. Any pain or tenderness?
No.
No, I'm gonna have you flex and extend. Great, and now we're gonna check your wrist. Any pain or tenderness?
No.
Good. So we're gonna have you extend your wrist, flex your wrist, and then radial deviation, ulnar deviation. Great. And we're gonna go on to the elbows. We're gonna assess the whole Cranon process. No tenderness, no nodules. No bursitis or joint swelling.
Hi, how are
For
you?
this, I'm gonna have you flex, extend, and then we'll move your hands back and forth for pronation and supination. Great. And while I have you here, I'm gonna test the muscle strength. Pull against me, up, and push down. Great. And now we're gonna go on to the shoulders. I'm gonna feel the greater trochanter or greater tubercle at the humerus, along the clavicle to the AC joint.
And what's today's date?
no swelling, no tenderness, no muscle atrophy. And okay, I'm going to stand behind the patient and have her lift her arms over her head and down behind and out to the side. And while they're out to the side, I'm going to have you press up against me and down against me. Great. And then over your head and behind your back. Reach to your elbows. Great. For internal and external rotation. Now I'm going to go to the knee. Look at her knees, no swelling. The version here, skin is same color throughout. No swelling, no tenderness. Great. So I'm going to have you extend your leg. Great. And bring it in and flex. Great. And extend your leg. Bring it in and flex. Now push out your legs against me and pull back in. Great. Now we'll look at her ankles. No nodules or swelling, no joint deformities. Any tenderness?
No.
No tenderness is noted. I'm going to have you dorsiflex, plantar flex, turn it in and out for inversion and eversion. Next, we're going to look at the toes and the midfoot, in between the toes, in between the plantar surface. No lesions, no breakdown, no nodules, no fissures. I'm going to have you spread your toes wide, curl them back in. Great. I'm going to have you lay down now, and we're going to check out your hip line. So I'm going to have you lift this hip up. Great. We're going to flex. We're going to extend and adduct, and bend it in. External rotation, internal rotation, and then push up against me. Great. And we're going to do the same for this leg. Flex in, out, abduction, adduction, internal rotation, external rotation. Great. And push up against me. Good. You can sit up. Have you stand. Okay. Have you face this way. We're going to check the paraspinal muscles all along in the spine. Any tenderness?
No.
No tenderness. Posture is upright. No scoliosis or anything noted, so you can visualize. Upright. And then we're going to have her stand by the gate and walk towards the table. It is even and walk back. It is even. Stance is good. And I'm going to have you walk heel to toe now. And this is a testing for balance. And on the way back, walk on your toes. And on the way back again, walk on your heels. Great. Good balance. Okay, I'm going to have you come back towards me, and we're going to test the flexion. We're going to test the range of motion of your spine. I'm going to have you lean forward and touch your toes. Great, and lean back and bend backwards a little. Okay, now go side to side. Great. Any pain or tenderness with that? Good. And while you're standing, I'm going to have you put your hands by your waist. And for 15 seconds, we're going to close your eyes and we're going to assess your balance. Great.
Extraocular vision, and I want you to follow
No swaying,
and light.
no changes in balance. Okay, and now we're going to have you stand with your palms up and close your eyes again, and we're going to assess for any pronator drift. and that was the Romberg before.
Now we're gonna check for convergence. Good convergence. Okay, so we're gonna
Okay.
proceed.
Great. And now I'm gonna have you sit back up here, and we're gonna check your reflexes.
And the sensitive part of your cranial.
So you can see better.
Close your eyes.
So we're gonna check them bilaterally. I'm only gonna show you on one side though. Okay. Great. And then we'll check the brachioradialis
Okay, so was it?
and the tricep.
Now I'm gonna check your,
You can see better on this side for the tricep.
Can you,
Great. And then we're gonna do patella
can you open your mouth?
and Achilles.
Okay, do you feel any tenderness? I didn't feel any flips, so it's fine. Now I'm gonna pump you the temporal arteries. More extra pulsation.
And then check the
Alright,
plantar.
now I'm gonna check your motor part of your upper facial nerve.
Good. And now I'm gonna have you do finger to nose. So touch my finger and then your nose. Nose.
And now,
Great. And I'm gonna have you take your heel and run it down your shin and your other one as well. Good.
just,
And now I'm going to check
okay,
um,
off your chest.
the sharp and dull. Okay, this is sharp and this is dull.
I'm gonna check your
Dull,
ears.
sharp,
And I'm gonna
Sharp.
first I'm gonna check your
dull,
the whisper
Sharp.
test. Okay.
Dull.
So for that I'm gonna close your one
Sharp.
ear and I'm
Sharp.
gonna whisper something
Dull.
to your
sharp.
ear.
Good.
And you tell me what it is.
And now we are gonna test the vibratory. This one vibrates. Okay, so I'm gonna hit this and put it on your fingers. Tell me if you feel a vibration or
Okay.
not. Okay.
Can you tell me
Yes.
where do you hear it?
Yes, yes, yes.
Great. And I'm gonna put a couple things in your hand, and you tell me what the object is.
A pen
When you stop hearing it.
and reflex.
Great.
Okay. Tell me when you stop hearing it.
And
Okay, so you
I think that's it. I wanna make sure there's all this in. Yeah, that's it.
Mm-hmm.
I think that's it.
okay, now we're gonna
Yeah, bye. Yes. See you later.